Hi everybody, welcome to Healthline. I am Gregory Zarian. So it is October, and October is Breast Cancer Awareness Month. That means you get your pink on. That means you have a conversation. You talk about signs, symptoms, and it's just not about women. Did you know that out of every new 100 diagnoses, up to 1 to 3 are men? So breast cancer just doesn't affect females, it affects males. And if there's a breast cancer diagnosis in your family, it affects your family, your friends, and your orbit. So signs and symptoms are preventative. What you need to know and what you know can possibly change someone's life. And our mission here is to always give you as much up-to-date information as we possibly can. So we brought back one of my favorites, Dr. Dennis Holmes from Glendale Adventist Medical Center, and he is a breast surgeon. And welcome back.
Great to be back.
And you've been qualified as one of my favorites.
Thank you.
And
I'm privileged.
No, I love my time with you because we get to see each other once a year and share some really important information. Since last time we saw you, doctor, are there any updates, anything new about signs and symptoms, or how much better we're doing in regards to prevention of breast cancer?
Well, the greatest change over the last year has been breast cancer events related to COVID, meaning that because of the COVID pandemic, many women have not been screened as regularly as possible, and so we're finding breast cancers that are being diagnosed at a later stage because they're not being detected by mammography, which is the preferred way for detection. So because of the delay of half year to a year in some cases or more, women are coming in with lumps that they find on self-examination that could have been detected a half year or a year earlier with mammograms.
And what's interesting about that is for the past year, as we've been dealing with COVID, every episode we have, I say, hey, you know, Glendale Adventist Glendale is equipped for you. They are practicing social distancing. Your doctors are there for you, and then you can also do Zoom chats with your doctor. Mm-hmm. So a lot of fear put more breast cancer out there.
Yes, I guess that's another major development. I'm doing a lot more telehealth visits than I am.
That's it, telehealth.
Yes, instead of, so for people that, because of distance or perhaps their visit doesn't require,
sure,
a face-to-face visit, we can discuss certain things by phone. I think about 20% of my appointments now are telehealth appointments as opposed to face-to-face appointments. And it does help to facilitate care, facilitate communication, so that we're not putting off appointments just because we can't have that one-on-one time with our doc.
And one thing too that I think is very, very important is just talk about it. Mm-hmm. Especially with moms, daughters, aunts, nieces, and even, as I was saying earlier, men. Mm-hmm. Just have a conversation and say to someone, hey, this is what I feel, or do you see that? And just share more about what you are experiencing and what's not there. When we come back, we will share with you updated signs and symptoms, what you need to know. And here's a question. It's a true or false question. Do nuns get diagnosed with breast cancer more so, or do they not? When we come back, we'll give you the answer. Don't go away. Welcome back to Healthline. I am Gregory Zarian, and it's October. October is Breast Cancer Awareness Month. Get your pink on, have a conversation, and pink is a great color for all of us. Joining us from Adventist South Glendale is one of my favorites, Dr. Dennis Holmes, breast cancer surgeon. But it's also breast surgeon.
Yes.
True, not just breast cancer surgeon.
Exactly.
So doctor, I headed out with the question about nuns and quite a few breast cancer diagnoses. Why is that? First of all, is it true or false?
The answer is true.
And why is that?
Well, there's a higher risk of developing breast cancer among women who do not bear children. Okay. We call it nulliparity. And so because of the fact that through their menstrual life they have repeated cycles of the menstrual without disruptions with pregnancy, the continuous exposure of estrogen does increase the lifetime risk of breast cancer in nuns as well as other women who choose not to have children during their lifetime.
And that means be more diligent in regards to self-exams?
Yes, be more diligent regarding self-exams,
and also
diligent for screening, and
sure,
also diligent with efforts to reduce your risk. You can offset an increased risk related to non-childbearing with doing things that reduce the risk, like exercise, weight management, proper nutrition, and so forth.
But that's also not inviting saying, hey, you know what, be sexual in your life so that this doesn't happen.
Yes, the reverse isn't exactly true. There is a point at which you can, the frequent multiparity,
Sure.
having many children, can also increase the risk as well. So like many things, there's balance, and there are some positives to childbearing. There's positives to breastfeeding if someone does have children, because
Sure.
that also commits the breast to doing something that is like a temporary focus job, making milk, as opposed to cycling every month. And the combination of childbearing and breastfeeding together reduce the risk of breast cancer in the future.
We will come back to more signs and symptoms and risks. Once again, what got you into the field of breast cancer and breast surgery?
Well, I was affected by cancer indirectly. I have had multiple cancer diagnoses in my family.
I'm sorry.
And I had to, be the care provider for family members. But also it immersed me in the field of oncology, dealing with cancer doctors, dealing with the problem. I began to talk with other people who I found out were also frequently affected by cancer directly or indirectly. And I realized it was a much more prevalent problem than I ever knew. Specifically, I've kept hearing the theme of breast cancer,
Sure.
breast cancer diagnosis, everyone being directly or indirectly affected by it. And it drew my attention to it not only as a problem that needed attention, but also upon learning more about how it's treated, I learned it was an area that needed some innovation, improvements in how it could be treated. And so it was a perfect marriage for me, a frequent problem that needed, updated solutions. And that's why I focused my career on this area.
And it was also personal.
Oh, it's very personal, yes. I mean, my career was, I was planning to be a vascular surgeon, a blood vessel surgeon. That was my first calling, if you will. But that was personal in one way, but this is even more impactful because, I had vascular surgery issues in my family. But when I heard that, when I learned of sort of the impact of oncology, breast cancer, and cancer in general, it touched me in a different way. And it made me want to commit myself to not only performing that as a surgeon, but also conducting research to make it better. In many ways, breast cancer is an imminently treatable condition. It's something for which people can survive as long as they're diagnosed early, and even for some late stage diagnosis. But in many ways, the treatments can be quite morbid.
Sure.
And so it's kind of ironic that you have something that's so curable, but it has morbid treatments. So a better situation is, of course, to have something that is curable and have treatments that are not that burdensome. And so that's why it was a marriage for me, and something that sort of met that was a good fit for my sensibility about how we should take care of healthcare problems.
Thank you for that answer. And what I really respect about your passion in this field is it is personal to you. And as we have spoken before, each patient or each diagnosis, there's a personal bit of attention, there's a personal attention to it.
Yes.
A lot of people think doctors see all these people and, it's not personal, but what I love about you and Adventist South Glendale is the physicians we have on this show, it's a personal connection. My doctor, Narine Artunian, it's personal. And she wants to even if it's through the teleconference, the telecommunications, it's an experience and it means something. So thank you for sharing that with us.
Thank you.
Before we already head out to our next break, what is your history in regards to studying and your expertise into this field?
Well, my expertise is focused on reducing the burden of care, and even that is personal because a lot of the things that I do now in research were things that were brought to me, the focus was brought to me by patients. I mean, patients that were challenged by something that we had to offer who asked for something better. I didn't simply listen to what they said and tell them, sorry, this is all we have, so you have to select the options that we have. Those interactions led me to find different ways of treating breast cancer so that we could sort of meet patients where they are, so that they had options that were that were appropriate for their risk tolerance. So that led to innovations in radiation therapy, innovations in breast cancer surgery, as well as cryoablation, which is tumor freezing as an alternative to surgery.
More Dr. Holmes when we come back. Do not go away. Welcome back. If you haven't received your COVID-19 vaccination yet, slow the spread of this virus by getting vaccinated as soon as you can. You can get as much information as you want from AdventistHealth.org and also have a conversation about it. And if you have any questions about whether or not you want to get vaccinated or you don't, it's all about a conversation. There's no right or wrong. It's just about learning what you don't know. Joining us from Adventist Health Glendale is Dr. Dennis Holmes. Doctor, I'm still moved by your last answer about sharing with me and us how important the conversation of breast cancer awareness, prevention, and your passion behind it is. So once again, thank you for that. What is your medical history? What got you to this point in regards to schooling?
Well, I went to Tulane Medical School after attending college, trained there, and then did a residency in surgery, general surgery, and then a fellowship in breast surgical oncology. So I progressively became more specialized as a breast surgeon. So that's what I practiced, and I've practiced that for the last 18 years. And
you have your pink on, so I love that. Statistics. About 1 in 8 U.S. women, 13%, will develop invasive breast cancer over the course of her lifetime. In 2021, this year, an estimated over 280,000 new cases of invasive breast cancer are expected to be diagnosed in women in the U.S., along with short of 50,000 new cases of non-invasive breast cancer. Just so people understand, what is non-invasive breast cancer?
Non-invasive breast cancer is breast cancer that is still confined to the milk ducts,
okay,
and has yet to penetrate the wall of the milk duct to invade the surrounding breast tissue. The main distinction is that when breast cancer is confined to the milk ducts, it doesn't yet have the chance to spread or leave the breast. It's a local problem. Once it becomes invasive,
which can be remedied quicker.
Which can be remedied quicker and treated with a purely local problem, meaning to remove that spot, to address that spot. Once it becomes invasive, it has the potential to get into the bloodstream, into the lymphatic vessels, and spread beyond the breast. So it becomes a systemic problem, something that must be treated not just locally, but there also must be steps taken to see if there's spread and to manage the risk of spread.
Doctor, out of the gate, tell me signs and symptoms of breast cancer.
Well, the best scenario is to have no symptoms at all. That would be the result of breast cancer diagnosed from screening mammography or screening ultrasound. But
what's the age of screenings?
I recommend starting at the age of 40.
Age of 40.
For the average risk woman, unless they have a high risk of family, a high risk of breast cancer in the family. Sometimes we start earlier. But for the average risk woman, we start at the age of 40 and continue yearly with mammograms.
When do you recommend self-exam?
At the age of 20.
Okay.
Yes.
And even if somebody wants to start it earlier, they can. I have a friend that was diagnosed with breast cancer in her teens. Mm-hmm. And it's basically, if you see anything different or feel anything different, have a conversation about it.
Right. It is about getting to know your own breast anatomy. Every breast is different. The shape, different parts of the breast vary from other parts of the breast. It's important to know your baseline breast anatomy. That's the way you detect changes. And so learning that early and maintaining that over the lifetime it helps to detect breast cancer on exam. But we prefer to detect it before it is detectable by exam. And that's with screening mammography or ultrasound.
And then I also read this morning that more breast cancer is diagnosed in the left breast. Why is that?
Because people are right-handed and they're more likely to examine more closely and with better detail with their right hand.
Interesting. Okay. What are other signs and symptoms? What do women and even men need to look for?
And the story is the same for both. If without screening, a lump is the most common finding. There may be very localized pain, like pain in one spot.
Can a bruise be accompanied with a lump or no?
Yes, but often it's what I think happens more in my observation is that there's a lump that's present and then there's an injury that happens to the breast.
Okay.
And since tumors have more blood supply, they're more likely to bleed or bruise. And so they're
inside or on the outside of the breast?
Bruise within the breast, but then it travels to the skin.
Got it. Okay.
So people sort of associate the injury as with the cause of breast
Got it.
cancer. It actually is just a side effect, meaning
Okay.
that the cancer bled, and that's what led to the bruise, which led to detection. So you can have nipple retraction or skin retraction, where the nipple is pulled in and or an area of skin is pulled in. There can be a rash of the nipple or areola. We call that Paget's disease. There can be swelling of the breast. There can be redness of the skin. And those are the most common clinical or physical signs of breast cancer.
And same thing for men as well?
Yes.
Is there pain with it?
It can be painful.
Okay.
I mean, breast cancer most often is not painful, but the presence of pain should not make you feel that you can't have a breast cancer. There are some cancers that are painful. It has to do with, in many cases, how close it is to the skin or if it's next to a nerve, but they can be painful.
And then also, before we already head out, is self-exam is just you hold up your arm. You can do it standing or laying down and just feel around. And you're looking for something that doesn't feel normal.
Yes, ideally in an orderly way, so you're doing a consistent exam from one breast to the next and from one time period to the next.
Okay.
It often helps to lubricate your hands with soap
Okay.
or in the shower or using with lotion.
More Dr. Holmes when we come back. Do not go away. Welcome back. I am Gregory Zarian, and it's all about pink. October is Breast Cancer Awareness Month, and joining us from Adventist Health Glendale is Dr. Dennis Holmes. Doctor, some research I found this morning, can too many mammograms contribute to a breast cancer diagnosis?
Well, any form of radiation can contribute to cancer, and
Okay.
that includes breast cancer, and mammograms are performed with x-rays. So yes, there is a small risk of
Okay.
breast cancer experienced over a woman's lifetime. Now, so what does it actually mean? Well, out of 100,000 women, it's estimated that about 20 to 25 will develop breast cancer over 40 years of screening
Okay.
related to mammography. But at the same time, over that, out of 100,000 women, about 13,000 will develop breast cancer just because that's how frequent breast cancer is from various causes. So you have a much greater chance of having breast cancer happen just by chance, 13,000, as opposed to 20 out of 100,000. The odds are clearly in your favor that you're more likely to have a breast cancer diagnosed early and have it diagnosed early in the way that prevents you from dying breast cancer than it is to have a breast cancer caused by mammography. Now, to put it slightly differently, the risk of breast cancer from mammography is lower than the risk of dying from a motor vehicle crash,
Wow.
from choking,
Okay.
from dying in a fire, from dying on a bicycle trip. There are many things that we do daily that have a much higher risk
Sure.
of death in your lifetime than mammography. So I'm not saying you shouldn't bike and you shouldn't drive a
Live
car,
your
or you
life.
shouldn't walk. You have to live your life. And having a mammogram is about living your life. It's about taking measured risks to do something that will prevent you from having a much worse outcome that will affect you, your family, and your community. So I think the risk of breast cancer caused by mammography is exceedingly low,
Got it.
and the benefits greatly exceed those risks.
And if somebody gets a mammogram, if a female or gets a mammography, and there is shadow or shading or anything, it doesn't immediately mean go onto the internet, Google, and panic. It just means it just could be that the density of the breast is different on one side over the other. True?
Right. Well, you know, radiologists are trying to get to know your breast as well. And so when mammograms are done, sometimes they see things that are new that weren't seen before, or there's a different angle that wasn't seen before. So they may often ask to repeat studies to have a better look at that area. But in most instances, the final decision is that the results are benign, it's just your normal breast anatomy, that you should come back the next year for a recheck. But, you know, 13% of women do have something
Sure.
that is meaningful, and mammography facilitates early detection of that. So that's why it's important.
Is there an age that women should stop getting a mammogram?
Yes, but there's not a specific age.
Okay.
We usually say that when your life expectancy is less than 5 years, because
Okay.
of whatever reason,
Sure.
then the gain for diagnosing and treating, the years gain from diagnosing or treating breast cancer are lost. So if you're 60 and you have very poor health, and your doctor tells you that at least statistically speaking, you're not likely to live another 5 years, then doing mammograms to detect the cancer early is not really going to add any years to your life.
Got it.
But if you're 80 and you're in great health and you have projected survival of another 10 or 15 years, it makes sense to continue to perform mammograms, because if you're diagnosed, it could potentially shorten your lifespan, even if you're 80. So it depends upon your general health.
And depending on the stage that breast cancer is diagnosed and caught, each situation is different. Each surgical procedure, each recovery is different. So not everything looks the same in regards to a breast cancer diagnosis.
That's so true.
Since we only have a little bit of time left, and I wish we had an hour, prevention. Talk to us all about prevention.
Well, the most important thing about prevention is that it's possible.
Sure.
And that it often relates to lifestyle. And the most common lifestyle modifications that are associated with a lower risk of breast cancer is exercise. Ideally, exercise.
When you say exercise, how much a week?
Well, things that increase your first of all, the type is things that it involves cardio. So walking, climbing, biking, things that increase your heart rate. And the minimum threshold would be about 2.5 hours a week. So that's 30 minutes a day, 5 days out of the week. That would be the goal. The benefit is even better if you can do more than that. The other thing is managing your weight. Body fat makes estrogen. Body fat increases the risk of breast cancer. So staying lean makes a difference. There's also evidence that eating a diet rich in fruits and vegetables also reduces the risk of breast cancer. And it goes along with maintaining your body weight as well.
Sure.
Yes.
And cutting out cigarettes. Say no to drugs, alcohol, all of it in moderation if you're going to have a glass of wine.
Yes.
And I'm getting plenty of drinking lots of water and plenty of sleep. What do you say to the person that says, oh, I don't have enough time to get exercise and I work a full-time job and you don't get it, I'm taking care of a family. What do you say to them?
I think that people are usually able to find time for the things that they think are important, whatever those things are. And it might be their family, that might be the thing that's most important, but they find time to do that. But their health is also important for their family, and finding time to take care of yourself so that you can be there for your family is an important thing. And sometimes you find time by combining, like do things with your family that are more active so that you both can benefit from being more active, or do things with managing your diet so that with your family so that you all can have improved weight management. But we always find a way to do things that are really important to us.
With every excuse is a solution.
so we have to just prioritize this as well.
Thank you for your passion and your commitment and wearing your heart on your sleeve in regards to breast cancer and breast cancer awareness. Will you come back again? I can't wait to have you back. So, breast cancer, the conversation of breast cancer, prevention, awareness, diagnosis, it's not just about the patient, it's about all of us. So have a conversation about it. Get your pink on. Guys, it's about you having a conversation with your wife, your spouse, your mom. Women, it's about bringing in the family. It's about doing it as a family. Get up, get out, walk together, eat together, create together. Put down the phone, get off the TV, get off the gaming device, and learn about one another. Our mission here is to give you as much information as possible so that you can pass it on. So hopefully, you or someone you love can possibly save a life. Breast cancer, it's not a death sentence. It's a conversation that you can have. And how awesome would it be if you gave something over and you prevented a positive diagnosis? Self-exam, talk about it, be fearless with what you learn and what you know. Remember, the most important conversation you're going to have is about you and your health. Have a great one. Thank you for joining us. You can find us on all types of social media. You can find us on their website at adventisthealth.org. You can find us on Facebook, and you can always find me on @GregoryZarian. We'll see you next time. Get your pink on. Thanks.